Yesterday I had the privilege of being at Walter Reed, on the steps of Walter Reed, waiting for an American flag to arrive, delivered by a group called Team Red, White, and Blue. It's one of the veteran service organizations that believes that our veterans have so much to contribute when they return to this country. This group had run this flag across the United States, 3,800 miles. They started on September 11th on the West Coast, and yesterday they delivered this flag to me. I will keep it in my office on top of the desk that Omar Bradley used when he was the administrator of Veterans Administration. 3,800 miles in roughly 60 days. That's 3 marathons a day, and many of the individuals who ran that flag ran it on prosthetic legs. In fact, it was Will Reynolds who delivered the flag to me. He lost his leg in combat. Incredibly inspiring stories. And that's why I'm here this morning. When my dear friend and American patriot Howard Schultz asked me to attend and to talk a little bit about the book For Love of Country, it's one of the best books I've read because it demonstrates to all of us that these veterans who have served in combat or have served their nation have so much to offer and come back and provide the leadership, the courage, the perseverance needed to make a difference in our nation when they return. And so I salute Howard and Rajiv for the book. I thought it was a terrific book. I loved reading it, and I hope we sell many, many copies of it. It's really our privilege and our pride at the Veterans Affairs Department to care for those who have borne the battle. Without question, it's the most noble and inspiring mission that anyone could have. Nowadays, the nation does a better job of honoring veterans than it used to. I was privileged to be at the first game of the World Series in Kansas City, honored by Major League Baseball, and Major League Baseball decided to honor veterans. Admiral Sandy Winnefeld and I were privileged to be there with a staff sergeant who had served in Afghanistan and Iraq, and he threw out the ball, and not surprisingly, he threw a strike to the catcher. But veterans are still a minority in this country. Less than 7% of Americans are veterans, and less than 0.7% are currently serving. That's 2.2 million people out of a 318 million population. Some communities and occupations have even fewer veterans. So it's important to remind people of the sacrifices veterans have made. It's especially important that our policymakers, our opinion leaders, our employers understand what it means to be a veteran. They need to know what veterans have accomplished, what they can accomplish as leaders, laborers, and citizens. So as I said, I really applaud Howard and Rajiv's book because I think it's their book and the Washington Post and Lockheed Martin sponsoring this discussion that is really opening up a whole new way to look at the differences our veterans will make when they return to this country. Their efforts and yours can make my job of serving veterans a lot more successful. Right now, the Department of Veterans Affairs has before it perhaps its greatest opportunity to enhance care for veterans in its history. Last July, my friend and Deputy Secretary Sloan Gibson, my West Point classmate, met with Dr. Harvey Feinberg, who's a distinguished healthcare leader. When Sloan commented that VA could accomplish more in the next 2 to 3 years than we could have in 2 to 3 decades, Harvey jumped in right away and said, no, he said, VA can accomplish more things now than it could ever have accomplished before. And he's right. We're in an extraordinary position. We have an opportunity to not only right the wrongs that have occurred, but to lengthen our lead in areas where we've already excelled, to take the lead in service delivery, and to chart new ground in emerging or evolving areas of healthcare. In the past 3 months, we've developed a plan we call the Road to Veterans Day. and we've set our sights on 3 non-negotiable goals. First is to rebuild trust with veterans and rebuild trust with stakeholders. Second is to improve service delivery, focusing only on veteran outcomes. Third is to set a course for long-term excellence and reform. We've made progress on all 3, but we still have work to do. From June to September, we've completed over 1 million more appointments in our facilities than in the same months last year. We've also authorized over 1 million veterans to receive care outside the VA, a 46% increase over last year. We've developed something we call the Blueprint for Excellence to reestablish VA's leadership in healthcare. And we've begun what may become the largest restructuring in the department's history. We call that reorganization My VA because that's how we want veterans to view it. We want them to view us as their VA. They know who to contact. They know where to go on the websites. They know what benefits are available, and they can easily connect with us to get the benefits and the services that they've already earned and deserve. This week, we've also begun implementing the new Veterans Access, Choice, and Accountability Act. We call it CHOICE Act for short. It provides $5 billion to hire more doctors, nurses, and other medical staff, and that was one of our deficiencies. It provides another $10 billion to fund additional purchase care while building our internal capability. Now, VA has always used purchase care when needed, but with the CHOICE Act, we're taking it to a new level in a program we call Veterans Choice Program. Just this week, we stood up a special staff and a call center to verify eligibility and answer questions about the program. The number we want veterans to call is 1-866-606-8198. We've also begun extending the option of purchase care to eligible veterans who live more than 40 miles from a VA facility. In the coming month, we'll do the same thing for veterans who have been waiting too long for an appointment. We define that more than 30 days from the clinically appropriate date or the date preferred by the veteran. In a few months, every veteran enrolled for VA healthcare will have a Veterans Choice card to use for authorized non-VA care in the future. The first choice cards were mailed out this week. The Veterans Choice Program can be a big part of the solution to our access problem. But the new law is extremely complex, and we need to make sure we get things right. We need to make sure VA doctors and non-VA doctors both know what the other is doing for each veteran, and that veterans get the screening and preventative care that they need. Saturday, I was in Dallas speaking to the American Medical Association specifically about this point and the need for us to work together. We also need to make seeking and receiving purchase care as easy as possible for both veterans and qualifying physicians. For those reasons, we've signed contracts with 2 healthcare companies with experience running similar programs. That's TriWest and HealthNet. And we'll be working with them to administer CHOICE program in the best possible way. The CHOICE Act will go a long way toward enabling VA to meet the current demand for care and to support the large-scale reforms we're making for long-term excellence. But one thing I've learned since my confirmation as Secretary is that there's no substitute for VA. Veterans need VA, they want VA, and Americans everywhere benefit from VA. They benefit from the $1.8 billion we spend in VA research, leading to major breakthroughs in medical science and care. Things like the shingles virus vaccine, things like the first implantable pacemaker, things like the treatment of HIV and hepatitis C. They also benefit from VA training. Did you know that VA trains 70% plus of U.S. doctors? 62,000 medical students and residents, 23,000 nurses, and 33,000 other single year. And Americans benefit from VA's highly specialized knowledge and know-how to deliver clinical and rehabilitative care for those who have borne the battle. And remember, healthcare is just one of 9 VA lines of business. Other lines include life insurance, mortgage insurance, education, pensions, disability compensation, and memorial affairs. We've got reasons to be proud of other accomplishments as well. We've cut the disability claims backlog by 60% in the last 20 months. We've completed 1.3 million claims for veterans in 2014. That's 150,000 more than last year. We guaranteed 2 million home loans with the lowest foreclosure rate and the highest satisfaction rate in mortgage lending. For the past decade, the American Customer Satisfaction Index has rated our cemetery system the top customer service organization in the nation, public or private. And since 2004, the same index has also shown that veterans give VA healthcare higher ratings than patients at most private hospitals. With the right strategies and support, there's no reason why we can't scale this performance excellence VA-wide. But we can't do what needs to be done without public and private partners, especially on the jobs front. We need to educate more employers on the value of veterans as leaders and as workers. Past generations returning from Europe and Asia made this country great. Today's generation of veterans will do exactly the same thing, as Howard and Rajiv showed in their book. They're disciplined, they're dedicated, they're hardworking, they're with a wealth of knowledge, skills, and experience. They've learned to put service before self, to bridge the difference between accomplishing shared goals, persevering in the face of obstacles, choosing the harder right rather than the easier wrong, and setting the example for others to follow. At a time when our country faces so many challenges, we need to make the most of what veterans have to offer. And they need and deserve our help in making the sometimes difficult transition from military to civilian life. So by investing in veterans, we're investing in America. As my buddy Sloan Gibson likes to say, it's both the smart thing to do and the right thing to do. Thanks again to the Post, to Lockheed Martin for sponsoring this discussion, to Howard and Rajiv for writing such an outstanding book, and to all of you for taking the time to be here today. Special thanks to the service members and veterans here today for your service to our nation. May God bless you all. Thank you.